Hello, this is the Cursing Seamstress, and I'm here to talk to you today about something totally unrelated to sewing. I had a medical procedure recently, and I had a difficult time finding anything about the subject matter online, especially when it came to videos. There was literature about it. But it was pretty dry and not very personal. So I thought that I would share with you my experience with having a torus removed. Those of you who don't know what a torus is, it's T-O-R-U-S. The plural is T-O-R-I. And I'll just read this to you. You can find this online as well. I am on Wikipedia, and what I had was called a Torus palatinus. It's T-O-R-U-S P-A-L-A-T-I-N-U-S, and that is on the maxilla, which is the upper jaw, as opposed to the mandible, although people can get those on the mandible as well. So a Torus palatinus is a bony protrusion on the palate. Palatal tori are usually present on the midline of the hard palate. Most palatal tori are less than 2 centimeters in diameter, but their size can range throughout life. The prevalence in women is about 20%. They're more common in women. They're more common in Asian, Native American, and Inuit populations. Interrupted by a phone call. So it's more common in Asian, Native American, Inuit, which are like Eskimo people. And I don't, to my knowledge, have that ancestry at all. My ancestry is all Scottish and British. So that doesn't really apply to me. Again, 20% of the population, it's equal among, between blacks and whites. And there is a familial causation to the torus. My mother apparently has a small one. It's never caused her any trouble. So what it is it's an overgrowth of bone. The palatinal refers to the roof of the mouth. And I think I first became aware of it. I don't even think I knew that it was anything unusual until my dentist pointed it out, and I was probably in my 40s. And he made note of it, and then he started saying things to me about going to see an oral surgeon to get it removed. Well, it really didn't cause me any problems, and I told him that I was fine with it. The last time I went to the dentist was probably 4 months ago for a routine cleaning, and he went to take an x-ray of an upper molar, and he couldn't get the x-ray film inside to get a good picture. So, and I had already, I think, sort of made up my mind that I needed to do something about it. I had noticed that I would get food sort of caught in the torus, and I noticed that I was having a little bit of a difficult time saying K sounds very clearly, and I may still do that, but my K's, my Q's, CHR sounds were wetter and just squishier, I guess is the best way to say it. So I did notice that. I don't know if anybody else noticed that. I've asked people about whether or not they noticed that I had that trouble, and only one person has said that they did, and that was the girl who does my hair. So I just want to tell you my experience. I couldn't make the appointment myself. All oral surgeon appointments had to be made through the referring dentist. So I got an appointment, drove, it's in a different state, just an hour away, and it was a very reputable, well-known office that I went to. I knew the oral surgeons who worked there before many years ago. I'm a nurse, and so I had heard their names. Those dentists, those oral surgeons had since retired, and it was a different group who was in there. They kept the same It's the same practice, but different dentist had come in. So I went in for the consultation, and I had a list of questions. The oral surgeon, I will not say his name, was very patient with me. And I told him I was absolutely neurotic, and I needed to go through all these things before I could actually go through the surgery. So I had a big list of questions, and I wanted to know exactly how they were going to do it, what sort of anesthesia they were going to use, what the recovery time would be, how much pain I would have. I even asked if they could only do a part of it, and then I could come back and have the second half done at a later date. And he thought that was hysterical. He said, why would you want to do that? So anyway, he was very patient. I had all my questions answered pretty much. And so I left, got home, and then followed up later with the date. And I had a friend drive me. Of course, you cannot, you're not allowed to drive home by yourself because you're post-anesthesia. I was so nervous about the procedure. I guess I thought I could see myself canceling and not doing it, but I didn't let myself do that. I just finally realized I had to have this done and that I was going to go through with it no matter what. I was worried about the general anesthesia they were going to use. I was worried about pain. I was worried about choking, all of those things. So, and when I got there, it just, the irony, the day that I went for the appointment, we had a very quick snowstorm to come in. The roads were icy. I live in the South, so it was sort of an unusual event. And the news reports were telling people, do not go out on the road, do not travel, the roads are horrendous. My friend who was driving me called me and said the same thing. The roads were awful, there were cars in ditches. He said, I'm going to be late. But he wasn't. He got here and he was driving his car. I don't know why. No four-wheel drive. So as it turned out, I drove. I do have four-wheel drive in my car. I drove. And as we got closer in to the town that the oral surgeons were, the roads became not icy, wet, and the precipitation became rain as opposed to snow and sleet. So that was good, and I got there and I expected the clinic not to be open. Well, everybody was there. There were patients, it was early in the morning, 9 o'clock, but patients were sitting in the waiting area, and things were going on as normal. So I did have to pay some money up front. I think it was $125 pre-surgery. And I did that that same morning before going back. They called me back pretty quickly. They put on a blood pressure cuff and I could see the monitor. My blood pressure was pretty high. It was 158 over, I think, 101. My blood pressure usually is 120 over 80, which is a normal blood pressure. So it was high. My pulse was fast. I was very, very nervous. And I told the assistant, I just reminded her, and I had asked him this before when I went for the consult, to please not to leave me in the room by myself with stuff in my mouth. I didn't want anything to go down my throat. And I told the assistant that when she was in the room, and she said, well, you'll be fine. She said, nothing will go down your throat because we put a lot of gauze back there. And of course that, I'm sure my blood pressure spiked another few points when I heard that, just the idea of having a bunch of gauze in the back of my mouth. But I thought, oh my gosh, I'm here, I'm in the chair. I'm not gonna, say, okay, stop. I'm not gonna do anything. I'm backing out of this. I just had made up my mind, and I think that's the point that everybody has to get to when they're facing something, that really in the scheme of things, this is not a big surgery. It's not a cancer surgery. It's not, they're not cutting, any organs or anything like that. So anyway, the doctor came in and I did ask if I not to be left in the room by myself, and he said he wouldn't. And he was very good. When he would leave the room, while I was awake anyway, he would tap me on the shoulder and he would say, I'm going to step out for a minute, but so-and-so's in here with you. And then when he would come back, he would kind of pat me on the shoulder and say, okay, I'm back. And then I know he didn't comment on my blood pressure or my pulse, but he did say, we're going to see if we can calm you down a little bit. And he went ahead and started the IV on my right arm. And I remember saying something else, carrying on a conversation, and that's all I remember. Until I do remember during the surgery, a couple of times that I heard the assistant telling me to open my mouth. And I think they were putting in some sort of, in my mind, I'm thinking that they were like column cushions or something to keep my mouth open. And I do remember that, and I remember following the command that she was giving me. The next thing I knew, I was awake. I was lying on my right side in like a little recovery area. My friend had come back into the room and was talking to me. I remember being just a little bit groggy. And my friend said something like, I'm going to say something to you and we'll see if you remember it later. And I didn't remember the name. He had said a name of an actor, and then he asked me later, and I said, I remember you asking me to remember this name of this actor, but I cannot tell you, what it was. And he reminded me it was Red Fox. So I had no idea afterward. But anyway, I remember just waking up. The roof of my mouth was not numb. And the only videos I could find on YouTube were foreign videos. And I found that to be very odd. And most of them were from Asian countries, maybe Singapore, places like that. And I did know or see that they gave injections of the numbing agent lidocaine or whatever they use into the palate. So I knew that was going to happen, but the roof of my mouth was not numb when I woke up. I had absolutely no pain when I woke up. I did have a piece of gauze that had been folded over, and it was just underneath where the sutures were, and my tongue was kind of supporting that. And then I was able to go home. I had prescriptions for hydrocodone with Tylenol, and I can't swallow pills, so it's liquid Vicodin. Prescription for that, prescription for a mouthwash, and a prescription for amoxicillin, an antibiotic. And so got home. I went ahead and on the instructions it said to make sure you stay on top of the pain. As soon as you get home, take the pain medication so it doesn't, you're on top of it and you're not behind it trying to catch up. And don't let the pain get control first. So I did. I took 1 dose of the hydrocodone medication. And I remember, I think I slept for a couple of hours on the couch. And I had no pain. I did not take any more pain medication. I took the antibiotic, the amoxicillin, 3 times a day for 10 days. I used the mouthwash. The instructions were to use it morning and evening. So I did that. I would brush my teeth and rinse out with this mouthwash. Chlorhexidine is the name of the prescription mouthwash. And do the same thing. Make sure at nighttime I brush my teeth really well. Use that mouthwash. And I've got a lot of the mouthwash left, and I'm still using it just to finish it off. My sutures, that was a question I had when I went in for the consult. They are dissolvable. They started falling out about a week after the surgery. I am only, 7, 8, 9, 10. I am 11 days post-op right now. So the sutures started kind of coming loose. I could feel them. And at one point I had a suture dangling down and dragging on my tongue. And that was driving me crazy. So I ended up just taking a pair of scissors and clipping that. And that was really the beginning. I noticed some other sutures started kind of hanging, dangling too. And I think I clipped another one, and I think they're all out now. And I'm sure I just swallowed them. They were fine sutures. They were kind of disintegrating anyway. There was not a lot of substance to them. So I just want to say that the shape, the torus is pretty much gone. It's not totally gone. It's been dramatically reduced. I have not been able to whistle in many years. And when I say whistle, I mean the kind of whistling like that kind of whistling. And that's not very good whistling. But I couldn't do that at all because of the shape of my mouth with the torus in it was restricted. I can say K's pretty well, Christy, Christmas, KKK, I can say the K sounds pretty well. So it's still a little bit there. If you don't like looking at the inside of people's mouth, you may not want to look at this. I am going to get close up to the camera. If you don't want to see it, please don't look. Stop right now. There's nothing gory about it. Some people just don't like looking at other people's mouths. I don't mind it. This whole video is meant to be educational and nothing else, and hopefully it's going to calm your fears if you're facing a similar surgery. So let me see how close I can get. I'm going to give you just a quick look. I don't know what you saw, but actually let me put my glasses on. Let me see if you can see anything. You probably can. There is just the slightest bump in the roof of my mouth. It is, it's so much better than it was. I am happy I had it done. I remember when I went for the consult and I was asking all my questions, and the oral surgeon said, you know, you're going to feel so much better when you have this done. And I do, and it's something I don't have to worry about anymore. You know, if it does grow more, I'm 59 years old, it's not gonna grow and ever be the size that it would need to be reduced again. And I forgot to mention too, that the reason most people have their toruses removed is that they're getting false teeth, dentures, and they have to smooth out the roof of the mouth in order to fit the dentures in. I am not there, and I hope I never am. So I'm good with this. I'm happy. I feel like my oral hygiene is going to be better. I'm not going to have food getting stuck around the torus. It's not going to interfere with my speech anymore. And I can just put it behind me. So anyway, if you have any questions, please leave them below. Excuse me, I'll be happy to answer them if I can. And I hope this will help to ease your fears. Again, if you're facing this, I think the best thing to do is just to get it done. So, all right, thank you so much for watching. If you like this video, if it was helpful, please give it a thumbs up. Thanks so much.